This presentation was first delivered as part of the Time to Change Employers Masterclass on how to measure the impact of mental health strategies in May 2020. We hope you find it useful.
Paul is from the firm Moore Kingston Smith, where he's a partner and has been since 1992. Paul also chairs the firm's charity committee and is part of Moore Kingston Smith's Wellbeing Group. Paul specialises in advising the healthcare sector, an area in which he regularly presents at seminars. Moore Kingston Smith have taken part in Mind's Workplace Wellbeing Index over the last 2 years, moving up from bronze to the silver award. They also signed a Time to Change Employer Pledge in 2019.
Well, thank you for that introduction, and good morning, everyone. Just a quick whiz through. We'll just looking at who we are. We can go on to the next slide. So just to put it into context as to who we are, as Ian has said, we're a firm of accountants and business advisors. We cover 6 offices around London and the southeast. If you're wondering where Durham is, it's about 250 miles north of St Albans on the M1. Just to say that people are who we are and what we do, as it says on the slide. We are very people orientated. We don't manufacture anything. We take trainees through, they qualify. We have various different departments: IT, HR, learning and development, practice development, facilities, as well as the qualified professional team. So service is key between us and our clients, and very important that mental health is at the key for us. On to the next slide. So why mental health for us, for Moore Kingston Smith? We've recognised that it is just as important as physical health, as we're told quite often, of course, and it's incumbent on us as partners, as owners of the business, to provide a happy environment. And this is now our strategic priority, and none more so than now during COVID-19, where our strategy is people first. And as we come through the slide presentation, you'll see how we've adapted during COVID to that. So we are a forward-thinking firm in many ways. Since late 2017, just over 2 years ago, we started the journey. So that sets the scene. And now, next slide. So how we're going to run through this presentation, we're going to evaluate our strategies. I'll explain what challenges we've faced, how the Mind Workplace Wellbeing Index has helped us, and how the results are used by us, and finally some top tips. As you'd imagine, with a firm of chartered accountants, return on investment is key. So we do look at impact measurement very seriously. We love figures and graphs, but underlying all of that, we're keen to make sure that we are bettering our mental health across the firm. So how we evaluate our impact. So there's 8 boxes there, and since we started on our journey, we trained over 15 mental health first aiders, and on a quarterly meeting basis, we all meet and discuss the themes or cases, strictly on a no-names basis, to ascertain what support might be needed, whether there are any key themes or struggles, and how we can signpost accurately. Within the people team, our people team, that's human resources and our learning and development department, together they work in tandem to look at trends and evaluate anecdotally the different cases across the firm. There's very much an open door policy maintained here at Moore Kingston Smith, and learning and development is key because they will set up any training that may be needed. And certainly one of the recommendations from our Silver Award was to improve and advance the training for managers. And that would be the responsibility of learning and development to set up. Surveys, we heard about surveys earlier this morning. And you can get very punch drunk with surveys. They need to be punchy. We need to demonstrate the purpose of the survey, and that we will take on board the themes that come through a survey. We've done the annual engagement survey, diversity and inclusion surveys, and now, in light of COVID-19, we're carrying out weekly pulse surveys. So these are quick and dirty, less than a minute to complete, and we're asking our teams, and again, we stratify the results of the survey across departments, offices, levels of staff, as to how they're feeling and whether they've had a good week, and how they're looking forward to the weekend or not. But surveys, very, very important. Employee assistance program, we'll discuss on some forthcoming slide in a bit more detail. The Wellbeing Network, that was set up probably about 4 or 5 months ago, and we are channeling information through the Wellbeing Group during COVID-19, an awful lot of advice. We've got an intranet hub where a lot of resources and information and guidance is put on the hub, and since COVID-19 hit in March, it's been invaluable. We've also laid on yoga, meditation, training, guidance, live sessions, and other bits and pieces, which we'll see later. Client and contact seminars, we've run those, and Jonathan has kindly jointly presented with us. Sell out every time, and incredibly useful. And we're moving into tomorrow, we're doing a webinar on well-being in the workplace as well. Now, our commitments and values are very important because they underline and underpin everything that we do. We have 10 commitments, if you like, but a number of them are about people. I'll just quickly run through what they are. The ones that relate to people. We will treat everyone with respect, fairness, and common courtesy, colleagues and clients alike. We will encourage honest and open communication. We will encourage a diverse, collaborative team structure, a we, not I. We will always encourage and listen to new ideas, even if we disagree. We will look to the long term for the MKS group, for our people and our clients, to ensure we fulfill our potential. Finally, in relation to people, out of the 10, we will at all times engender a sense of togetherness and fun in our work to create an environment of constant development. So out of 10 commitments, 6 are people-based. Quite important, and we follow up on that. They aren't just words. We follow up on that on appraisals, staff appraisals. Staff have the opportunity to contribute to a 360 degree appraisal on people, managers, partners, and effectively bosses, to give feedback, and that is presented in line with our commitments as to see how individuals have performed. And then our intranet, I mentioned, we've now got a wellbeing hub on our intranet, an awful lot of information there for people. And within our HR section of the intranet, there's advice about the EAP policy and how people can contact the employee assistance program. Next slide. So you wouldn't expect an accountant to be presenting without some figures or graphs. Okay, here we go. So since 2017, if we look at the graph on the left-hand side, our staff roll number, as it were, has increased. We've moved from 482 to 568 members of staff, excluding partners. And the total number of sick days peaked at 1,900, and reduced back to 1,700 on a higher number of employees basis, which is good news. And then looking across per employee, you'll see that the number of working days lost per employee is around 3, having peaked at 3.68 and having been just under 3 in 2017. So information is collected along with regular sickness reporting. We ask the reasons for sickness, and those are shared with partners where appropriate on a monthly basis, and actions taken forward by the relevant teams. But since we've embarked on the wellbeing journey and mental health being key, as I say, we've increased our training, and mental health and the stigma around mental health is obviously what everyone is trying to reduce. And I'm delighted to say that over the last 3 years, the number of employees that have reported absence due to mental health is increasing year on year, but the number of employees being off sick has gone down. So if you look at that, 2017, the first year, 3% of staff were reporting mental health issues as their reason for sickness. And that's increased in 2018 and 2019 to just under a third of absenteeism has been reported as being mental health related. So clearly we're improving the culture of being able to talk about and raise the issue of mental health. And as I say, by the previous slide, the number of sick days has gone down proportionate to the number of staff. So that's all good news. I should say that COVID-19 presents other issues, such as presenteeism, whereby people are attending work, they're working, but they are suffering, and perhaps they should not be working and they should have phoned in sick. But because we're not in a 9 to 5:30 day, you know, people are working flexibly and think they can work when realistically they should be off sick. There are resilience plans for people to complete where appropriate, to give them an idea of what the day ahead might be. Planning for them is very important. I mean, it's key that none of us feel 100%. We have good days, we have bad days during COVID. So we move on to the Employee Assistance Programme. I'm sure lots of you have that in place. It is a confidential advice line, direct access to counsellors, be it on a call, telephone call, be it face-to-face or be it online. I should stress that we don't hear who the member of staff may be. We get a report from the EAP people that tells us how many people have contacted them in a given period. They tell us the whether or not it's an employee or a relative, and they tell us the gender, and that's as far as it goes. The rest is completely anonymous, but it is a very useful way of finding out what is wrong, what trends there are, whether or not there are any models or initiatives that we can put in place to ease the issues that staff are facing. On to the next slide. So we see there the reasons for contacting EAP. Mental health is 70%. This was a report from March last year to February this year. We're waiting for the next quarter's results, which will be very interesting during the COVID lockdown, mid-March. That will be very interesting, March 2020 onwards. But you'll see there it does cover a number of different areas, not just mental health. It might be relationships, it might be finance, it might be legal things. I'm glad to see that whistleblowing is 0. That's very comforting to know. But it can also cover bereavement and life events. So we're going to be looking out very closely at the next quarterly report. So, and there you see as a pie chart how the figures break down. Online, a lot of people just simply going online for information on the EAP. On Health Assured as the provider we use, 73%, and calls 12-13%. So again, very interesting to see the results of that and to see what trends there might be. And recognition, well, delighted that we've been awarded Employer of the Year in the Gatwick Diamond Business Awards, which is Southern-based, Gatwick down to Brighton, and also West London Business Awards, and also a Bronze Award for the Armed Forces Covenant. So, you know, we're measuring our impact by way of awards as well. We're winning awards for the work we're doing on mental health. Another way we've got involved with mental health, and you might see at the bottom of every email as an email footer, we have a link to this record, which was recorded by Nigel Planer of the Young Ones fame, you might remember many years back, and Neil Avery. Neil approached me and asked for our support. We were happy to sponsor it. And it is a very moving record. The video that goes with it shows the effect of mental health on an individual who's been shunned by their friends, and it's a very solitary start, works through to actually a broad smile and communicating being the key. So we got involved with that. For our staff, it was a real plus because a few of them were involved in the video recording of it. This is still online for people to watch, and it's refreshed every Mental Health Awareness Day comes out again, but it's there for people to see. So, what challenges have we faced along the way? Buy-in from employees. Well, I mentioned about surveys and survey fatigue, and numbers can dwindle. But we do try to be as transparent as possible as to why we're using the data. We've put on events during lockdown, as I say, yoga, virtual quizzes, lunch and learn sessions. We have to face up to the fact that some employees feel comfortable with their own mental health and haven't understood the importance of the resources available to them. And so, you know, they're happy in their own space and they're not necessarily going to buy in with us. But the communication style, I think, I'm a passionate advocate of good, friendly, warm communication styles. I don't want to see black Arial font 10 standard emails about well-being, because that's the corporate stuff that we contact our clients about, and that's how we lay out our emails. I want them to be fresh, innovative, colourful, and bright, and I think that, you know, little things like that can make an awful difference. We have lanyards. Mental health first aiders have lanyards that distinguish us as being mental health first aiders. And mental health first aiders have been particularly keen during COVID-19 to ring round and have proper discussions. We've incepted the idea of virtual cuppers, and we keep a log of those as to how many we've done, just giving us the opportunity to catch up with the person that we might see at the coffee machine in our day-to-day normal life, working life. But of course, in our new environment, we don't get the chance to see them and catch up. So that's another way of communicating, which might get over the barrier. Time. You know, we're not counsellors, we're not medical professionals, but we have to ensure that each case that comes to us or we spot is dealt with carefully and met with empathy. So mental health is not formulaic, and we try to be understanding of that. And this can be a challenge when we face key performance indicators. More recently, as I said about COVID, we've had to adapt our strategies for that, and it's opened up tricky areas: financial well-being, furloughed staff, how they are affected by it and what their apprehensions may be, and making sure that furloughed staff are included, perfectly permissible, on every email that relates to well-being or social interaction, very much that they're not excluded. And in terms of measurement, we were keeping a log of the emails and the information that we've been sending out. We can tell how many people have opened the emails, and we can tell how many people have logged on to our intranet hub. So overcoming these challenges, I sort of touched on them already, but you'll see there Zoom comes into play, the use of virtual platforms for quizzes, not just the standard sending out a word quiz. We do interactive quizzes where we do it on Zoom and we have an interactive scorer, so it's live. Leadership, absolutely key with mental health. That actually our managing partner has video calls every fortnight giving updates. We can monitor the number of people that have logged on. We record it as well, and we can see who has watched it after it's gone out. But we've been getting high attendances on those, which is very, very encouraging and very important. I mean, it's important to say that, of course, in this COVID-19 period, there's no blueprint for how to deal with life during COVID. It's a new experience for everyone. We're all learning. There's no license or course to prepare for it. But I have to say, having had the well-being and mental health being at our forefront over the year just gone, the year and a half just gone, it's made it an awful lot easier to go through the COVID crisis and be able to provide resource with really not too much heavy work. We're moving from a position of having that knowledge. Right, so moving on. So overcoming the challenges, as I've said, courageous conversations, and that's quite important, and that requires training, and we are rolling out courageous conversation training to our managers and partners, because we have to be able to ask the difficult questions, and then we can signpost. We're not going to be addressing and dealing with the problem ourselves unless it's specifically work focused. We're going to signpost, but we have to be able to find what the problem may be. We have agile working across the firm and have done before, well before COVID-19. But obviously the new normal is going to change things, and that requires a lot of discussion with staff. Some will feel very apprehensive about returning to work, and obviously it's going to be a staged return. It's not going to happen overnight, but we recognise that there are issues about that. So our journey, as I say, Mind became our charity partner in January 2018, with Jonathan being our account handler all those 2.5 years ago. And we quickly realised how beneficial the relationship was. We moved to taking part in the Mind Wellbeing Index. We were awarded bronze. We signed the Time to Change pledge, as Ian mentioned, and we have progressed through. So it's a very short, relatively short time frame that we've progressed through. So the Wellbeing Index has given us credibility across the firm and the wider community. Staff recognise that we are taking it really seriously. The surveys lend credence to that. The percentages are certainly there for all to see, and the benchmarking has really helped enormously. Staff surveys as well, and the pulse surveys. So the Mind Wellbeing Index recommendation was to sign the Time to Change pledge, which we did, and our strategy was, as a result of getting bronze, was to set up the Wellbeing Network, the intranet hub, refresher training for mental health first aiders, and more people manager guidance was developed. Those were the actions around the bronze to get to silver. We got a 56% score overall, various questions and points. And then moving on, by using the bronze data and recommendations, we were able to get silver. So key figures that came out of that: 43% of those who experienced poor mental health whilst working at MKS felt confident they would be supported. Looking always to improve on that. The feel that staff at Moore Kingston Smith have a good awareness and knowledge of mental health, 60%. And then 82% felt that Moore Kingston Smith runs initiative to raise awareness of mental health. So bearing in mind that's from a 2-year standing start, we're absolutely delighted. And I think the investment has really paid off during COVID-19, we believe. And by participating in the Workplace Wellbeing Index, as well as the Time to Change pledge, we review the findings. It's a really useful tool to have. We're not alone in our journey. We've got the support there to be able to take it forward, and we are believing that we are on a journey towards a better way of working and supporting the mental health of our people. As I said, people first, as part of our everyday business. So the results are being used meaningfully. As I said, we were able to distinguish the reasons for absence, distinguishing between physical and mental health reasons. And we feel that employees are beginning to feel more comfortable disclosing mental health as a reason for absence. 87% of employees felt Moore Kingston Smith promotes well-being in the firm, and that's what we would look to maintain, increase. Now that we've got the hub, I think it's fairly apparent. I would hope that figure would increase. EAP, the Employee Assistance Program, data shows that service is in demand, so we get statistics from that. We can measure the impact of that. We can change our EAP provider if we feel that the information that is being provided to our staff is not sufficient or is not timely. We always ask for feedback from training and wellbeing sessions. Indeed, all our learning sessions, we immediately ask for feedback. And our pulse survey, the most recent one, we've got the results for, we've got another one coming out on Friday, is that 57% of our workforce are coping well with COVID-19. So where does that leave us? Well, immediately we got those results. We did a light touch drill down. Managers then got in touch with their teams, partners got involved, and we had an open session. So on Zoom, with probably no more groups, more than about 15, just really sort of trying to find out a bit more how we could support even more than we do. It is difficult because the challenges that people are facing from working at home are both space-wise, accessibility-wise, whether their Wi-Fi is strong enough, whether they've got childcare to look at. And these are areas which largely are outside our control. We'll try and do our best. We certainly have supplied a lot of IT equipment and sent stuff out so that people have better hardware and software to help them, guide them through and trying to improve their well-being during this time. And from further growth mindset training has been implemented. That came out from our surveys as well. And as I say, challenging conversations is another area that we're looking at training. And I should stress that well-being is now on every meeting agenda and has been for the last 6 months. So, whatever type of meeting you're in, well-being will be on there. So it's quite important. And finally, we come on to our top tips. You aren't expected to know all the answers. There is a lot of resource out there mind invaluable, absolutely invaluable. Time to change as well. I mean, the resources are limitless, really. Whether it's a wellness action plan, whether it's a resilience action plan, they're all out there. And the key, I think, the big tip about all of this is don't be afraid to ask for help when it comes to looking for resources. And during COVID-19, everyone is in the same boat. No one has been on this journey before, and so we're all learning from each other. So use your networks, and remember your staff are your biggest asset. And anything you can do and be visible in what you're doing would really help. I think the key also, if you haven't already started on this route, or even if you have, is to look at the team that is leading your well-being, because you've got to have passionate advocates for this. It's serious stuff, and it needs people that have that compassion and can drive it forward, and it needs the leadership at the top to drive that as well, to be able to measure the impact, to see the benefits that you're bringing to your organization by having such a fantastic resource. It's great for recruitment, it's great for retention, and it's great for your staff that you have. So there we are, the compassionate community, people first. I think that is probably it.